If you're pregnant and feeling overwhelmed by all the information about vaccine, take a deep breath. You're in the right place. Today, we're going to calmly and clearly explain which vaccines are recommended during pregnancy in the United States, why doctors recommend them, and how they help protect both you and your baby during the most delicate months of life. This is about understanding, not pressure, about science, safety, and peace of mind. And if this kind of evidence-based, reassuring content helps you feel more confident in your pregnancy, don't forget to like this video, subscribe to the channel, and join our growing community of expecting parents who are learning together. Pregnancy is a time of profound transformation, and with those changes comes a natural increase in vulnerability. As the body adapts to support new life, the immune system also shifts, becoming more sensitive to certain infections. Medical recommendations around vaccines are designed with this reality in mind, focusing on protection rather than intervention. Understanding this helps expecting mothers feel grounded instead of overwhelmed. Vaccines recommended during pregnancy are not arbitrary decisions, but carefully studied measures based on decades of medical research. They are introduced at moments when the body can respond effectively while also passing protective benefits to the developing baby. This dual purpose is what makes maternal vaccination uniquely valuable during pregnancy. Rather than adding risk, these vaccines work to reduce preventable complications that could otherwise disrupt a healthy pregnancy. Severe illness during pregnancy can affect breathing, oxygen levels, and overall stability for both mother and baby. Prevention becomes an act of care and foresight. Knowing that these recommendations exist to support, not alarm, can bring peace of mind. Pregnancy care is about minimizing unnecessary risks while allowing the body to do what it was designed to do. Vaccination fits into this broader philosophy of gentle, evidence-based protection. As pregnancy progresses, especially into the third trimester, the physical demands on the body increase significantly. The lungs, heart, and immune system are working harder than usual, which can make infections more dangerous than they would be outside of pregnancy. Medical guidelines account for this increased vulnerability when recommending vaccines. These recommendations are made with a clear understanding of timing. Vaccines are offered when they can be most effective and safest, aligning with how the body naturally responds during pregnancy. This timing ensures that protection is maximized without interfering with fetal development. The goal is not to overwhelm expecting mothers with medical procedures, but to strengthen their natural defenses. By reducing the likelihood of severe illness, vaccines help maintain stability during a period when rest and balance are essential. This approach allows pregnant women to focus on their well-being and connection with their baby, rather than worrying about preventable health risks. Knowledge replaces fear, and preparation replaces uncertainty. One of the most reassuring aspects of pregnancy vaccination is its ability to protect two lives at once. When a mother receives a recommended vaccine, her body produces antibodies as part of a natural immune. These antibodies don't stay with her alone. Through the placenta, these protective antibodies are passed directly to the baby before birth. This means the baby enters the world with a level of immune protection already in place, something that cannot be replicated after delivery alone. This biological transfer is a gentle, natural process. It does not force the baby's immune system to act prematurely, but instead provides borrowed protection during the earliest and most vulnerable months of life. Understanding this connection can bring comfort. The mother's body becomes a bridge of protection, extending care beyond pregnancy and into the baby's first days. Newborns face a unique challenge. They are highly vulnerable to infections, but are too young to receive many vaccines themselves. This gap between birth and early childhood vaccinations is one of the reasons maternal vaccination is so important. By receiving vaccines during pregnancy, mothers help close this gap. The antibodies passed on act as a temporary shield, while the baby's own immune system matures. This protection can significantly reduce the risk of severe illness during early infancy. This process is especially meaningful for parents who worry about the first week. Knowing that their baby has an added layer of protection can ease anxiety and promote confidence during the transition to parenthood. Rather than replacing pediatric care, Maternal vaccination complements. It creates a continuum of protection that begins before birth and continues through infant. Safety is a common concern for expecting mothers, and understandably so. Vaccines recommended during pregnancy are evaluated with a higher level of scrutiny than many other medical interventions. Their safety profiles are continuously monitored through large population studies. Healthcare recommendations evolve as new data becomes available, but the core principle remains the same. Benefits must clearly outweigh any potential risks. This is why only specific vaccines are recommended during pregnancy. When guidelines support maternal vaccination, they reflect a broad medical consensus, not a single opinion. This collective expertise provides reassurance that recommendations are grounded in real-world outcomes. Trusting this process allows mothers to feel supported rather than pressured. The emphasis remains on informed choice and personalized care. It's important to remember that pregnancy care is not one-size-fits-all. While vaccines are recommended for most pregnant women, individual health factors are always considered. This personalized approach is central to modern prenatal care. Open conversations with healthcare providers allow space for questions, concerns, and unique circumstances. These discussions empower mothers to make decisions that align with their health history and comfort. Rather than being a rigid rule, vaccination is part of a flexible care plan designed to adapt to each pregnancy. This adaptability helps reduce stress and fosters trust between patient and provider. Feeling heard and informed transforms medical guidance into collaborative care, which is essential during pregnancy. Medical recommendations are shaped not only by scientific data, but also by lived experience. Over time, healthcare providers have observed how infections impact pregnant women and newborns differently than the general population. These observations reinforce why prevention plays such a critical role during pregnancy. Avoiding severe illness can mean avoiding hospitalization, early delivery, or complications that affect both mother and baby. Vaccination is one of the few tools that can offer protection before exposure occurs. This proactive approach aligns with the preventive nature of prenatal care. Understanding this context helps mothers see vaccination as part of a larger safety net, not an isolated decision. Emotional well-being is just as important as physical health during pregnancy. Anxiety and uncertainty can take a toll, especially when navigating complex medical information. Clear.com explanations help restore a sense of balance. Knowing that vaccines are recommended to protect rather than harm allows mothers to feel more grounded in their choice. Information becomes a source of strength instead of fear. Pregnancy is filled with decisions, and confidence grows when those decisions are informed and supported. Vaccination discussions should leave mothers feeling reassured, not rushed. Peace of mind contributes to a healthier pregnancy experience overall. Public health guidance continues to evolve, reflecting ongoing research and emerging data. This evolution does not indicate uncertainty, but rather responsiveness to new information. It shows a commitment to improving care. In recent years, some recommendations, particularly regarding COVID-19, have been debated. These discussions highlight the importance of individualized risk assessment rather than blanket advice. Many experts continue to support vaccination based on personal health factors, exposure risk, and medical guidance. This nuanced approach respects both science and individual circumstances. Recognizing this complexity helps mothers feel validated in seeing personalized advice. At its core, pregnancy vaccination is about protection, preparation, and compassion. It reflects a desire to support both mother and baby during one of life's most delicate periods. When understood fully, vaccination becomes less about fear and more about empowerment. It allows expecting mothers to take an active role in safeguarding their health and their baby's future. Every pregnancy journey is unique, but the goal remains the same: a healthy mother and a healthy baby. Medical recommendations exist to support that goal with care and respect. With knowledge, support, and thoughtful guidance, expecting parents can move forward with confidence and calm. During pregnancy, a woman's body goes through complex immune and physiological changes. These changes are natural and necessary to support the developing baby, but they can also make infections like influenza and COVID-19 more severe. Medical research has consistently shown that pregnant women are more likely to experience complications from these illnesses compared to non-pregnant adults. The influenza and COVID-19 vaccines are recommended because they significantly reduce the risk of severe disease. They do not eliminate all possibility of infection, but they greatly lower the chances of hospitalization, respiratory distress, and life-threatening complications. This protective effect becomes especially important as pregnancy advances. Vaccination helps the body prepare ahead of time. Instead of responding to an active infection while already under physical stress, the immune system learns to recognize the virus safely and efficiently. This preparation allows the body to respond more calmly and effectively if exposure occurs. For many expecting mothers, understanding this purpose brings reassurance. These vaccines are not about fear of illness, but about strengthening the body's natural ability to cope during a sensitive season of life. Influenza and COVID-19 can place significant strain on the respiratory system, which is already working harder during pregnancy. As the uterus grows, lung capacity naturally decreases, making breathing more demanding. Any illness that affects the lungs can therefore have a greater impact on pregnant women. Vaccination helps reduce this burden. By lowering the likelihood of severe respiratory symptoms, these vaccines support overall oxygen levels and circulation, which are vital for both mother and baby. Maintaining stable oxygen delivery is a key factor in healthy pregnancy outcomes. This stability also reduces the risk of complications that could lead to early delivery or emergency medical intervention. Preventing severe illness allows pregnancy to progress more smoothly and predictably. Knowing that these vaccines contribute to respiratory protection can ease concerns and help mothers feel more confident in their prenatal care decisions. One of the most important benefits of influenza and COVID-19 vaccination during pregnancy is the transfer of antibodies to the baby. When a pregnant woman is vaccinated, her immune system produces antibodies specifically designed to recognize and fight these viruses. These antibodies cross the placenta during pregnancy, reaching the baby before birth. This process gives the newborn immediate immune support during the early months of life, when their own immune system is still developing. This protection is especially meaningful because infants are at higher risk of severe illness from respiratory infections and are too young to receive these vaccines themselves. Maternal antibodies act as a temporary shield during this vulnerable period. Understanding this natural transfer of protection helps many parents feel reassured that vaccination is a way of caring for their baby even before birth. Breastfeeding, when chosen, can extend this protection even further. Antibodies produced by the mother continue to be passed to the baby through breast milk, supporting the infant's immune defenses after birth. This ongoing transfer does not replace routine pediatric care, but it provides additional support during the earliest stages of life. It is a gentle continuation of the protection that began during pregnancy. Even for mothers who choose not to breastfeed or are unable to do so, the antibodies passed during pregnancy still offer significant early protection. The benefit begins before delivery and does not depend on any single feeding choice. This layered approach to protection reflects how thoughtfully these recommendations are designed to support diverse families and circumstances. Another important aspect of influenza and COVID-19 vaccination during pregnancy is timing. Vaccination earlier in pregnancy allows the immune system time to respond fully and build strong antibody levels. This timing ensures that both the mother and baby receive the greatest possible benefit, especially as the pregnancy progresses into later stages when vulnerability increases. Early preparation helps avoid last-minute decisions during stressful moments. Healthcare providers consider seasonal patterns as well, particularly for influenza. Vaccination before peak flu season offers the most effective protection. This proactive planning helps create a sense of calm and readiness throughout pregnancy. Safety concerns around vaccination are common and completely valid. Influenza vaccines have been used in pregnancy for many decades, with extensive data supporting their safety. COVID-19 vaccines have also been closely monitored in pregnant populations worldwide. Large studies and ongoing surveillance have shown no increase in adverse pregnancy outcomes linked to these vaccines. This includes outcomes such as miscarriage, preterm birth, or developmental. Medical recommendations are continuously reviewed as new data emerges. This ongoing evaluation helps ensure that guidance reflects the most current and reliable evidence available. Knowing that safety monitoring is active and continuous can provide comfort and trust in the recommendation. In 2025, discussions around COVID-19 vaccination during pregnancy became more complex due to changes and debates in public health recommendations in the United States. These discussions have understandably caused confusion for many expecting. Despite these controversies, many medical experts continue to recommend COVID-19 vaccination based on individual risk factors. These include underlying health conditions, exposure risk, and local infection. Rather than offering one universal answer, healthcare providers emphasize personalized decision-making. This approach respects both scientific evidence and individual circumstances. Understanding this nuance helps expecting mothers feel supported rather than conflicted when navigating evolving guidance. Conversations with an OB provider are central to making informed decisions about influenza and COVID-19 vaccination. These discussions allow space to address concerns, review personal health history, and consider timing. Healthcare providers can help clarify how vaccines fit into an individual pregnancy. This personalized guidance reduces uncertainty and builds confidence. When questions are welcomed and answered with clarity, medical care feels collaborative instead of directive. This sense of partnership is especially important during pregnancy. Feeling informed and supported can transform a complex topic into a manageable and empowering choice. Preventing severe illness during pregnancy has benefits that extend beyond physical health. Avoiding hospitalization or complication helps preserve emotional well-being and reduces stress for both parents. Stability during pregnancy supports better sleep, nutrition, and overall mental health. Vaccination contributes indirectly to these positive outcomes by lowering the risk of disruptive illness. Peace of mind allows expecting parents to focus on bonding, preparation, and self-care rather than worry. This emotional aspect of prevention is often overlooked but deeply meaningful. Ultimately, influenza and COVID-19 vaccination during pregnancy are about thoughtful protection, not obligation. They offer a way to reduce preventable risks while supporting both maternal and infant health. When understood in context, these vaccines become part of a broader commitment to gentle, evidence-based care. They align with the goal of creating the safest possible environment for pregnancy and early life. Every pregnancy journey is unique, and decisions should always feel informed and respectful. Medical guidance exists to support, not to pressure. With knowledge, conversation, and compassionate care, expecting mothers can move forward with confidence and calm. One of the most remarkable features of pregnancy is the biological connection between mother and baby. Beyond nourishment and oxygen, the mother's body also provides immune protection. When a pregnant woman develops antibodies, whether naturally or through vaccination, those antibodies become part of the baby's early defense system. This transfer happens through the placenta during pregnancy. It is a natural, well-studied process that allows the baby to benefit from the mother's immune experience before birth. The baby does not need to fight an infection to gain this protection. This early immune support is especially valuable because newborns enter the world with immature immune. They are still learning how to respond to viruses and bacteria in their environment. Knowing that the body is already working to protect the baby can bring deep reassurance during pregnancy. The antibodies pass through the placenta act as a temporary shield during the baby's first weeks and months of life. This period is one of the most vulnerable stages of human development, as the immune system is still forming. During this time, even common respiratory infections can become serious. Maternal antibodies help reduce the severity of illness and, in many cases, prevent infection altogether. This protection does not last forever, but it is designed to bridge a critical gap. It supports the baby until they are old enough to receive their own vaccinations and develop stronger immune responses. Understanding this timeline helps parents appreciate the purpose and timing of maternal vaccination. The transfer of antibodies is not something that strains the baby's body. Instead, it provides passive immunity, meaning the baby receives protection without needing to activate their own immune system prematurely. This gentle form of protection is ideal for newborns. It allows them to grow and adapt gradually while still being supported by the mother's immune system. Passive immunity has been observed and studied for generations, long before modern vaccine. Vaccination simply strengthens and directs this natural process. Recognizing this continuity between biology and modern medicine can help expecting parents feel more at ease with these After birth, this protective connection can continue through breast milk for mothers who choose to breastfeed. Breast milk contains antibodies and immune-supporting factors that further help defend the baby against infection. This ongoing support is especially helpful during the early months when babies are exposed to new environments and microorganisms. Breast milk adapts over time, responding to both the mother's and baby's needs. Even short periods of breastfeeding can provide immune benefit. There is no single right duration, and every family's situation is different. What matters most is understanding that protection can begin before birth and continue afterward in flexible, supportive ways. It is important to note that the benefits of antibody transfer during pregnancy are present regardless of feeding choices after birth. Babies receive meaningful protection through the placenta alone. This reassurance is important for mothers who may not be able to breastfeed or who choose not to. The immune support passed before birth remains valuable and effective. Pregnancy vaccination is therefore not dependent on what happens postpartum. Its benefits are already in place when the baby is born. This understanding helps remove pressure and reinforces that each family's choices are respected. The strength and duration of antibody protection depend on timing. Vaccination during pregnancy allows the mother's immune system time to produce a strong antibody response before delivery. Healthcare providers consider this timing carefully to ensure that the baby receives the highest possible level of protection at birth. This planning reflects a thoughtful, evidence-based approach to care. Rather than being rushed or reactive, maternal vaccination is designed to be proactive and intentional. This careful coordination contributes to better outcomes and greater peace of mind. Antibody transfer is particularly important for respiratory illness, which can be more dangerous in early infants. Viruses like influenza, COVID-19, RSV, and pertussis pose higher risks to newborn. Because infants cannot be vaccinated immediately against many of these illnesses, maternal antibodies serve as their first line of defense. This protection can reduce hospitalization and severe complications. Medical recommendations focus on these specific diseases because of their known impact on infants. The goal is to prevent the most serious outcomes during the most vulnerable period. Understanding this focus helps clarify why certain vaccines are emphasized during pregnancy. Scientific evidence supporting maternal antibody transfer comes from decades of observation and research. Large studies have consistently shown lower rates of severe illness in infants whose mothers were vaccinated during pregnancy. These findings are not limited to one country or healthcare. They reflect a broad, global understanding of how maternal immunity supports infant health. This consistency across populations strengthens confidence in these recommendations. Reliable evidence allows parents to make decisions rooted in trust rather than uncertainty. Public health guidance continues to evolve as new research becomes available. This includes ongoing discussions about specific vaccines, such as COVID-19, and how best to apply recommendations during pregnancy. In 2025, changes and debates in U.S. guidance highlighted the importance of individualized risk assessment. Many experts continue to support vaccination based on personal health factors and medical advice. This evolving landscape underscores the value of personalized care rather than rigid rules. Parents are encouraged to engage in informed conversations with their healthcare provider. At its heart, maternal antibody transfer represents one of the most nurturing aspects of pregnancy. It is a quiet, unseen form of protection that begins long before birth. Vaccination enhances this natural process, offering babies a safer start during their earliest days. It reflects a partnership between biology and modern medicine. When parents understand how this protection works, fear often gives way to confidence. Knowledge transforms complex science into something deeply human and reassuring. With support, information, and thoughtful care, expecting families can move forward with calm and clarity. Whooping cough, also known as pertussis, is a highly contagious respiratory illness that can be especially dangerous for newborns. While adults and older children may experience prolonged coughing, infants can face severe breathing difficulties and life-threatening complications. Newborns are particularly vulnerable because their immune systems are still immature. They do not yet have the ability to fight pertussis effectively on their own. This vulnerability is the reason medical experts emphasize prevention before exposure occurs. Protecting infants from pertussis begins during pregnancy, not after birth. Understanding the seriousness of whooping cough helps explain why the Tdap vaccine is recommended in every pregnancy. The Tdap vaccine protects against tetanus, diphtheria, and pertussis, but its primary purpose during pregnancy is protection against whooping cough. Pertussis can spread easily through close contact, even from people who do not realize they are infected. Infants can become seriously ill from minimal exposure. In severe cases, pertussis can lead to hospitalization, intensive care, or long-term complications. Because newborns cannot receive their own pertussis vaccine immediately, they rely on protection passed from the mother. This makes maternal vaccination an essential preventive measure. Vaccination during pregnancy creates a protective barrier around the baby during the most fragile stage of life. The timing of the Tdap vaccine during pregnancy is carefully chosen to maximize benefit. It is typically recommended during the later stages of pregnancy, often in the third trimester. This timing allows the mother's immune system to produce a strong antibody response. These antibodies are then passed efficiently to the baby through the placenta before birth. The result is that the baby is born with protective antibodies already circulating in their body. This protection is present from the very first day of life. This strategic timing reflects years of research and clinical experience. Receiving the Tdap vaccine in each pregnancy is important. Even if the mother was vaccinated in a previous pregnancy, antibody levels naturally decrease over time. By vaccinating during every pregnancy, healthcare providers ensure that each baby receives the highest possible level of protection at birth. This recommendation is not about repeated exposure, but about ensuring consistent and effective immunity for every newborn. Understanding this helps mothers feel reassured rather than confused by the need for repeat vaccination. The safety of the Tdap vaccine during pregnancy has been extensively studied. Decades of data support its use, showing no increased risk to the mother or the baby. Large-scale studies have consistently demonstrated that Tdap vaccination does not increase the risk of pregnancy complications. Instead, it significantly reduces the risk of severe pertussis in infants. Ongoing monitoring continues to support these findings. Medical guidelines are regularly reviewed to ensure they remain aligned with the latest evidence. This continuous evaluation provides confidence and peace of mind for expecting parents. Pertussis infections in infants often occur before parents even realize something is wrong. Symptoms can progress rapidly, making early prevention especially important. Maternal vaccination acts as a quiet safeguard during this unpredictable. It reduces the likelihood of severe illness and helps protect infants until they can receive their own vaccination. This preventive approach aligns with the broader goal of minimizing avoidable risks during early life. Vaccination allows parents to focus on bonding and care rather than medical emergencies. Healthcare providers around the world recommend Tdap vaccination during pregnancy based on consistent evidence of its benefit. This recommendation is not limited to one healthcare system or country. Global medical organizations recognize the effectiveness of maternal Tdap vaccination in reducing infant hospitalizations and deaths related to this widespread agreement reinforces the reliability of the guidance. Knowing that this recommendation is supported internationally can strengthen trust and reassurance. Conversations with healthcare providers help personalize the timing and context of the Tdap vaccine. These discussions allow mothers to ask questions and understand how the vaccine fits into their overall care plan. Personalized care helps reduce anxiety and build confidence. Feeling informed transforms vaccination from a stressful decision into a thoughtful. Healthcare providers are there to support, not pressure. Expecting mothers. This collaborative approach is a cornerstone of modern prenatal care. Preventing whooping cough in infants has benefits that extend beyond physical health. Avoiding serious illness reduces stress and emotional strain on families during the newborn period. Parents can feel more secure knowing they have taken steps to protect their baby during a vulnerable time. This sense of preparedness contributes to a calmer and more positive postpartum experience. Emotional well-being is an essential part of family health. At its core, the recommendation for Tdap vaccination in every pregnancy reflects a commitment to newborn safety. It is a proactive measure designed to provide protection before risk appears. Vaccination supports a gentle start to life by reducing exposure to serious illness. It aligns with the natural desire of parents to safeguard their child's health. When understood fully, the Tdap vaccine becomes a source of reassurance rather than concern. With clear information and supportive care, expecting parents can move forward with confidence and calm. Respiratory syncytial virus, commonly known as RSV, is one of the most common causes of serious respiratory illness in infants. While RSV can cause mild cold-like symptoms in older children and adults, it often affects infants much more severely. In young babies, RSV can lead to bronchiolitis, pneumonia, and significant breathing difficulties. These complications frequently require hospitalization, especially during the first months of life. This heightened risk is directly linked to the immaturity of an infant's immune and respiratory system. Their bodies are still learning how to respond to infection. Understanding the nature of RSV helps explain why prevention before birth has become such an important focus in maternal care. The first 6 months of life are considered the most vulnerable period for RSV-related illness. During this time, infants have limited immune defenses and narrow airways, which can worsen respiratory symptoms. There is currently no traditional vaccine approved for infants to prevent RSV during this early stage. This creates a gap in protection during a critical window of development. Maternal vaccination is designed to bridge this gap. By vaccinating the mother during pregnancy, protective antibodies are passed to the baby before birth. This early protection can significantly reduce the risk of severe RSV disease from the very beginning of life. The RSV vaccine recommended during pregnancy is relatively new, having been introduced in 2023 after extensive clinical trials. These studies focused specifically on safety and effectiveness in pregnant women and their infants. The goal of the vaccine is not to eliminate all RSV infection, but to reduce severe disease that leads to hospitalization. Even partial protection can make a meaningful difference for newborns. By reducing the severity of illness, maternal vaccination helps prevent complications that can disrupt early bonding and recovery after birth. Knowing that this vaccine was developed with infants' unique risks in mind can bring reassurance to expecting parents. Timing plays a crucial role in RSV vaccination during pregnancy. The vaccine is typically recommended between 32 and 36 weeks of gestation. This window allows the mother's immune system to produce a strong antibody response, while ensuring those antibodies are efficiently transferred to the baby before delivery. As a result, the baby is born with protective antibodies already present. This immediate protection begins on day 1, when vulnerability is highest. This careful timing reflects a thoughtful and evidence-based approach to maternal and infant health. Some infants may receive a monoclonal antibody injection after birth as an alternative form of RSV protection. Healthcare providers generally recommend either maternal vaccination or infant monoclonal antibody treatment, not both. Maternal vaccination offers the advantage of protection from birth without requiring an injection for the newborn. This can be especially appealing for families seeking early, passive protection. Both approaches aim to reduce severe RSV illness and the choice depends on individual circumstances and access. Understanding these options allows families to make informed decisions with their healthcare providers. Safety is a central consideration for any vaccine recommended during pregnancy. The RSV vaccine underwent rigorous testing to ensure it did not increase risks for pregnant women or their babies. Clinical trials and ongoing monitoring have shown reassuring safety outcomes. These findings support its use during the recommended gestational window. Medical guidelines continue to evolve as more data becomes available. This ongoing evaluation ensures that recommendations remain aligned with the best available evidence. Knowing that safety remains a priority can help reduce uncertainty and build trust. RSV seasons typically occur during fall and winter months, when respiratory viruses are more prevalent. Vaccination timing may therefore be influenced by seasonal patterns. Healthcare providers consider both gestational age and RSV season when recommending maternal vaccination. This ensures that babies are protected during periods of highest risk. This seasonal awareness reflects the practical application of medical research to real-world conditions. It also highlights the importance of early planning and open communication during prenatal care. Preventing severe RSV illness has benefits that extend beyond physical health. Hospitalization during early infancy can be stressful for both babies and families. Reducing the likelihood of severe illness allows parents to focus on bonding, feeding, and recovery after. Emotional well-being during the postpartum period is closely tied to infant health and stability. Maternal RSV vaccination supports a calmer, more secure start to life for the entire family. As with other vaccines, recommendations for RSV vaccination emphasize individualized care. Not every pregnancy follows the same timeline or circumstance. Discussions with healthcare providers help determine whether maternal RSV vaccination is the best option based on gestational season and medical history. This personalized approach respects both medical evidence and individual needs. Feeling involved in decision-making helps parents feel empowered rather than overwhelmed. At its core, maternal RSV vaccination represents a proactive step toward protecting infants during one of their most fragile stages of life. It offers protection before exposure occurs. By reducing the risk of severe respiratory illness, this vaccine helps support healthier outcomes for newborns and greater peace of mind for parents. When understood in context, RSV vaccination becomes a natural extension of prenatal care. With knowledge, guidance, and compassionate support, families can move forward with confidence and calm. Medical recommendations during pregnancy are never made lightly. Vaccines suggested for pregnant women undergo a higher level of evaluation than many other medical interventions because they affect two lives. This careful approach is rooted in both scientific rigor and ethical responsibility. Before a vaccine is recommended during pregnancy, researchers examine large amounts of data collected over many years. These studies look closely at maternal health, pregnancy outcomes, and infant well-being. Only vaccines with consistently reassuring results are included in prenatal guidelines. This long-term perspective helps ensure that recommendations are stable rather than reactive. Medical guidance reflects patterns observed across population, not isolated cases. Understanding this process can help expecting mothers feel grounded and confident in the care they are receiving. Many vaccines recommended during pregnancy, such as influenza and Tdap, have been used for decades. Their safety profiles are supported by extensive real-world experience involving millions of pregnancies worldwide. This long history allows healthcare providers to understand not only short-term effects, but also broader pregnancy outcomes. Patterns such as birth weight, gestational age, and infant development have been carefully observed. Because of this, recommendations are built on accumulated knowledge rather than theoretical assumptions. Experience reinforces evidence, creating a strong foundation for trust. Knowing that these vaccines are not new or experimental can offer reassurance to expecting parents. Even newer vaccines, such as the RSV vaccine, are introduced only after rigorous clinical trials specifically designed to include pregnant women. These trials evaluate both maternal safety and infant outcomes before approval. After approval, monitoring does not stop. Ongoing safety surveillance continues to track outcomes in real-world settings, ensuring that any unexpected patterns are quickly identified. This layered system of evaluation reflects a commitment to continuous learning and improvement. Medical guidance evolves as more information becomes available. This transparency helps reinforce confidence in the recommendations provided during pregnancy. Research on pregnancy vaccines considers not only physical safety, but also effectiveness. A vaccine must demonstrate a clear ability to reduce severe illness or complications to be recommended. For maternal vaccines, effectiveness is measured in two ways: protection of the pregnant woman and protection of the baby after birth. This dual focus is unique to pregnancy care. Studies consistently show reduced hospitalization rates and severe disease in both mothers and infants when recommended vaccines are used. These outcomes highlight why research-based prevention is prioritized in prenatal care. Medical research also accounts for timing. Studies examine how the body responds to vaccines at different stages of pregnancy to determine when benefits are greatest and risks are lowest. This is why some vaccines are recommended earlier in pregnancy, while others are suggested later. Timing is not arbitrary, but carefully aligned with immune response and antibody transfer. Such precision reflects the depth of research behind each recommendation. It ensures that protection is delivered when it matters most. Understanding this intention can help mothers feel reassured about vaccine scheduling. Long-standing medical experience also includes observing what happens when vaccines are not used. Historical data shows higher rates of severe illness and infant complications before widespread maternal vaccination. These lessons from the past inform current guidelines. Prevention strategies are shaped by understanding both outcomes and missed opportunities. Rather than reacting to crises, modern prenatal care focuses on reducing known risks before they arrive. This preventive mindset supports safer pregnancies and healthier newborns. In 2025, public discussion around certain vaccines, particularly COVID-19, became more complex in the United States. Changes and debates in recommendations highlighted the dynamic nature of medical guidance. However, these discussions did not negate the large body of research already available. Many experts continue to rely on individualized risk assessment supported by scientific evidence. This reflects a broader trend in medicine toward personalized care rather than rigid rules. Recognizing this balance helps expecting mothers navigate evolving information with confidence. Healthcare providers are trained to interpret research and translate it into practical guidance for patients. Their recommendations are shaped by both data and clinical experience. During pregnancy, providers consider personal health history, environmental exposure, and gestational timing. This individualized approach ensures that research is applied thoughtfully. Medical guidance becomes most effective when it is adapted to the person, not just the population. This personalized application of evidence strengthens trust in prenatal care. Trust in medical recommendations grows when expecting parents understand the process behind them. Transparency and open communication are essential components of this trust. When providers explain why vaccines are recommended and how research supports those recommendations, anxiety, often, knowledge allows parents to move from uncertainty to informed confidence. This sense of understanding contributes to emotional well-being throughout pregnancy. At its foundation, vaccine guidance during pregnancy reflects decades of scientific inquiry and clinical observation. It represents a careful balance between innovation and caution. Recommendations are shaped by evidence, refined by experience, and continuously reviewed as new data emerges. This thoughtful process exists to support healthy outcomes for both mother and baby. With clarity, support, and evidence-based care, expecting parents can feel reassured and empowered throughout their pregnancy. Most pregnancies follow a healthy and predictable course, which allows medical guidelines to apply broadly to the majority of expecting mothers. For this reason, most pregnant women are considered eligible for all 4 vaccines recommended during pregnancy. These recommendations are based on population-level data showing consistent benefits and reassuring safety outcomes. They are designed to support typical pregnancies while still allowing room for individualized care. Rather than being restrictive, this guidance aims to simplify decision-making. Clear recommendations help reduce confusion during a time when information can feel overwhelming. Understanding that these vaccines are generally appropriate for most pregnancies can provide comfort and clarity. Although most pregnant women are candidates for these vaccines, medical care always considers individual health factors. Certain medical conditions, allergies, or unique circumstances may require additional discussion. This personalized approach ensures that care is tailored to each individual rather than applying a rigid standard. It reflects respect for the diversity of pregnancy experience. Healthcare providers review medical history carefully before making recommendations. This review helps identify any factors that might influence timing or suitability. Knowing that personal circumstances are taken into account can help expecting mothers feel seen and supported. For the vast majority of women, however, no special medical conditions prevent vaccination. In these cases, the benefits of vaccination clearly outweigh potential risks. This balance is central to medical decision-making during pregnancy. Recommendations exist to reduce preventable harm, not to introduce unnecessary intervention. When guidelines apply to most pregnancies, it reflects confidence in the safety and effectiveness of the vaccines involved. This understanding helps build trust in prenatal care recommendation. Eligibility for pregnancy vaccines also considers gestational timing. Some vaccines are recommended earlier in pregnancy, while others are suggested later to maximize antibody transfer to the baby. These timing recommendations are designed to work with the body's natural immune response. They ensure that protection is provided when it is most effective. Even when all 4 vaccines are recommended, they are not given at the same moment. Spacing and scheduling are part of thoughtful prenatal care. This structured approach helps reduce physical stress and supports overall well-being. Healthcare providers play a key role in helping women understand which vaccines are recommended and when. These conversations allow for clarification and reassurance. Discussing vaccination as part of routine prenatal care normalizes the process. It becomes one element of a comprehensive health plan rather than a separate condition. When recommendations are presented calmly and clearly, anxiety often decreases. Trust grows through communication and shared understanding. Access to vaccines is another reason most pregnant women can receive all recommended doses. In many healthcare settings, vaccines are readily available in OB offices or local pharmacies. This accessibility reduces logistical barriers and makes it easier to follow medical guidance. Convenience helps support care. When vaccines are integrated into teen prenatal visits, they feel less disruptive. Ease of access contributes to a smoother pregnancy. Public discussions and media coverage can sometimes make vaccine recommendations feel more complex than they are in practice. Conflicting messages may create unnecessary confusion. In reality, healthcare providers rely on established guidelines and individual assessment. Their focus remains on the health and safety of both mother and baby. Understanding this difference between public debate and clinical care can help restore perspective. Personalized medical guidance remains the most reliable source of information. In 2025, changes and debates surrounding COVID-19 vaccination recommendations in the United States highlighted the importance of individualized care. These discussions underscored that recommendations may vary based on personal risk factors. Despite these debates, many experts continue to support COVID-19 vaccination during pregnancy when guided by individual assessment and medical advice. This approach aligns with broader principles of personalized medicine. It allows flexibility while remaining grounded in evidence. Recognizing this nuance helps expecting mothers feel empowered rather than uncertain. For most pregnant women, receiving all recommended vaccines is a straightforward part of prenatal care. It does not require special preparation or significant lifestyle change. Vaccination visits are typically brief and well tolerated. Most women continue their daily activities without interruption. This simplicity reflects the routine nature of these recommendations in clinical practice. Understanding this can help reduce apprehension and promote calm. At its core, eligibility for pregnancy vaccines reflects a balance between broad guidance and individual. Most women benefit from all recommended vaccines, while personalized assessment ensures safety for everyone. This balance allows prenatal care to be both evidence-based and compassionate. It respects individual needs without sacrificing clarity. When parents understand that recommendations are designed for most pregnant, confidence grows. With informed guidance and supportive care, expecting mothers can move forward with reassurance and peace of mind. Pregnancy care is built on communication and trust. One of the most valuable resources an expecting mother has is the relationship with her OB provider. These conversations create a space where questions are welcomed and concerns are addressed with clarity and care. Rather than simply receiving instruction, pregnant women are encouraged to understand the reasoning behind medical recommendations. This understanding transforms guidance into partnership. When information is shared openly, fear often gives way to reassurance. Knowing what to expect helps reduce anxiety and promotes emotional well-being. These conversations are a foundation for confident decision-making throughout pregnancy. Vaccination discussions are most effective when they happen within the context of a trusted medical relationship. OB providers are trained to explain benefit, timing, and safety in a way that aligns with each patient's needs. These discussions allow room for personal values and individual health considerations. No two pregnancies are exactly the same, and care should reflect that. By engaging in dialogue, pregnant women gain clarity rather than feeling rushed or pressured. Understanding replaces uncertainty. This collaborative approach strengthens confidence and autonomy. Many concerns around vaccines stem from conflicting information found online or through social media. OB providers help filter this information, distinguishing evidence-based guidance from misinformation. Having a trusted professional explain complex topics in simple terms can be deeply reassuring. It provides a reliable anchor amid overwhelming noise. This clarity allows pregnant women to focus on their health rather than sorting through endless opinions. Accurate information becomes a source of calm rather than confusion. OB visits offer a natural opportunity to discuss vaccination as part of routine prenatal care. When included in regular checkups, these conversations feel normal and supportive. Vaccination is framed as one aspect of a broader health plan that includes nutrition, monitoring, and emotional support. This holistic perspective helps women see vaccine not as isolated decisions, but as part of comprehensive. Feeling supported within a larger care framework builds trust and ease. Empowerment during pregnancy comes from understanding choices rather than feeling obligated. OB providers play a key role in ensuring that decisions feel informed and voluntary. When risks and benefits are explained clearly, pregnant women are better equipped to weigh options calmly. This transparency respects autonomy and reinforces confidence in personal decision-making. Feeling empowered contributes to a more positive pregnancy experience overall. Time and timing matter in prenatal discussion. OB providers help ensure that conversations about vaccines happen early enough to allow thoughtful consideration. Early discussions reduce last-minute stress and allow space for reflection. They also help coordinate vaccine timing with gestational milestones. This proactive approach supports smoother care and reduces anxiety. Preparation fosters peace of mind throughout pregnancy. OB providers also help contextualize evolving medical guidance. When recommendations change or are debated publicly, providers can explain what those changes mean for individual patients. This is especially important during periods of public discussion or controversy, such as changes to COVID-19 vaccine guidance in recent years. Personalized explanations help women feel grounded amid uncertainty. Professional guidance restores confidence when information feels unsettled. In 2025, changes and debates in COVID-19 vaccination recommendations highlighted the importance of individualized conversations with OB providers. These discussions became central to navigating evolving guidance. Many experts continued to emphasize vaccination based on personal risk, medical history, and exposure level. OB providers help translate these nuanced recommendations into clear, personalized advice. This individualized support reinforces trust and calm decision-making. Strong communication also supports emotional health. Feeling heard and respected reduces stress and builds emotional resilience during pregnancy. OB providers who listen carefully create a safe environment for expressing fears or uncertainty. This emotional support is just as important as physical care. Confidence grows when pregnant women feel supported as whole individuals. At its heart, prenatal care is a partnership. Conversations with OB providers empower pregnant women to take an active role in their health and their baby's well-being. Informed choices are more meaningful when they are made with understanding and support. Through clear communication and compassionate care, uncertainty is replaced with confidence. With guidance, trust, and collaboration, expecting mothers can move forward with calm and assurance. Pregnancy is not only a physical journey, but an emotional one as well. The body and mind are closely connected, and physical health plays a significant role in emotional stability during this time. Severe illness during pregnancy can disrupt routine, increase anxiety, and create uncertainty. Hospitalization or intense medical care often brings emotional strain in addition to physical discomfort. Preventing serious illness helps preserve a sense of normalcy and calm. Stability allows pregnant women to focus on rest, connection, and preparation. This balance between physical and emotional health is central to a positive pregnancy. When illness is prevented, the body can dedicate its energy to supporting pregnancy rather than fighting infection. This conservation of energy supports better sleep, nutrition, and overall well-being. Physical stability often leads to emotional reassurance. Feeling well allows expecting mothers to trust their bodies and feel more confident in the pregnancy process. Avoiding severe illness reduces the likelihood of unexpected medical intervention, which can be emotionally overwhelming. Prevention supports both the body and the mind in meaningful ways. Emotional stress during pregnancy can have lasting effects. Heightened anxiety can affect sleep, appetite, and overall quality of life. Preventing serious illness reduces one major source of stress. When health risks feel managed, emotional resilience often increases. Vaccination contributes indirectly to emotional well-being by lowering the chance of health emergencies. This sense of preparedness allows pregnant women to feel more grounded and secure. Hospitalization during pregnancy can be frightening, even when outcomes are positive. It often involves separation from familiar environments and increased medical monitoring. Preventive care helps reduce the likelihood of these experiences. Staying healthy supports continuity in prenatal care and daily life. This continuity promotes emotional comfort and stability. Feeling safe and supported contributes to a calmer pregnancy. Preventing illness also protects the emotional health of partners and family. When a pregnant woman remains healthy, loved ones experience less worry and stress. Shared peace of mind strengthens family bonds during pregnancy. It allows families to focus on anticipation rather than fear. Emotional support flows more easily when health concerns are minimized. This shared calm benefits the entire household. Mental health during pregnancy is increasingly recognized as a critical component of overall care. Preventing severe illness supports emotional balance and reduces anxiety triggers. Knowing that steps have been taken to reduce health risks can be empowering. It provides a sense of control in a time of many unknowns. This empowerment contributes to emotional strength and confidence. Preparedness fosters peace of mind. Public discussions around health risks can sometimes heighten anxiety for expecting parents. Conflicting messages may amplify fears rather than ease. Preventive care grounded in evidence helps counteract this noise. Clear guidance provides reassurance amid uncertainty. Vaccination decisions based on medical advice rather than fear support emotional clarity. Confidence grows when choices are informed and supported. In recent years, evolving guidance, particularly regarding COVID-19, has added complexity to pregnancy. In 2025, debates highlighted the need for individualized decision-making. Many experts continue to emphasize prevention based on personal risk and medical guidance. This approach respects both evidence and emotional well-being. Personalized care reduces stress by aligning decisions with individual circumstances. This thoughtful approach supports emotional stability during pregnancy. Preventive health measures also support postpartum well-being. A healthier pregnancy often leads to a smoother recovery after birth. Avoiding severe illness allows the body to heal more effectively and reduces emotional exhaustion. Emotional reserves are preserved for bonding and adjustment after delivery. Prevention supports a healthier transition into parenthood. At its core, preventing severe illness during pregnancy is an act of care for both body and mind. It reflects a commitment to protecting overall well-being. Vaccination is one tool within this broader preventive approach. It supports physical health while also fostering emotional reassurance. When expecting mothers feel protected and informed, anxiety often diminishes. With thoughtful care and evidence-based prevention, pregnancy can be experienced with greater calm and confidence. Pregnancy decisions are most empowering when they are informed and individual. Every expecting mother brings her own health history, environment, and experiences into pregnancy. Medical guidance is designed to support these differences rather than ignore them. Vaccination recommendations during pregnancy are meant to be discussed, understood, and personal. This approach helps transform information into confidence instead of confusion. When decisions feel aligned with personal circumstances, stress often decreases. Clarity allows expecting mothers to feel grounded in their choice. This sense of alignment is central to a calm and confident pregnancy. Individualized care recognizes that risk is not the same for everyone. Factors such as underlying health condition, exposure levels, and timing all influence medical decisions. Healthcare providers help assess these factors and translate them into practical guidance. This process respects both scientific evidence and personal context. Rather than offering one rigid answer, individualized care offers thoughtful direction. It allows room for nuance and understanding. Feeling that care is tailored builds trust and reassurance. Informed decision-making begins with access to clear, accurate information. Understanding how vaccines work, what they protect against, and why they are recommended creates a strong foundation for choice. When information is presented calmly and transparently, fear often diminishes. Knowledge becomes a source of empowerment rather than anxiety. This clarity supports thoughtful reflection rather than rushed decision. Confidence grows when understanding replaces uncertainty. Public health recommendations can evolve as new research becomes available. This evolution reflects responsiveness, not instability. In 2025, changes and debates surrounding COVID-19 vaccination during pregnancy highlighted the importance of individualized assessment. These discussions emphasized personal risk evaluation rather than one-size-fits-all guidance. Many experts continue to recommend vaccination based on individual health factors and medical advice. This nuanced approach supports both safety and autonomy. Understanding this context helps expecting mothers feel steady amid changing peace of mind during pregnancy is closely linked to feeling informed and supported. Decisions made with understanding tend to bring reassurance rather than doubt. When mothers know they have considered evidence, timing, and personal factors, confidence follows. This confidence supports emotional well-being throughout pregnancy. Reduced uncertainty allows space for connection, preparation, and rest. Emotional calm is a valuable outcome of informed care. Individualized vaccination decisions also support physical safety. Tailoring, timing, and recommendations ensures that protection is delivered when it is most effective. This precision reflects respect for the body's natural rhythms during pregnancy. It enhances benefits while minimizing unnecessary stress. Thoughtful planning reinforces a sense of preparedness. Preparedness fosters calm and stability. Healthcare providers play a key role in supporting informed decisions. Their guidance helps interpret research and apply it meaningfully to pregnancy. Open conversations allow questions to be addressed without pressure. Feeling heard strengthens trust and confidence. This collaborative relationship transforms medical advice into shared care. Supportive communication is essential for peace of mind. Confidence during pregnancy often comes from knowing that choices are reversible, revisitable, and open to discussion. Informed care allows flexibility as circumstances change. Pregnant women are encouraged to revisit decisions as new information arises. This adaptability reduces fear of making the wrong choice. Flexibility supports emotional resilience. Resilience helps expecting mothers navigate pregnancy with grace. When vaccination decisions are made thoughtfully, they often bring a sense of empowerment. Taking an active role in healthcare reinforces confidence. This empowerment extends beyond pregnancy into early parenthood. Feeling capable and informed supports smoother transition. Confidence built during pregnancy carries forward into caring for a newborn. Informed choices lay the groundwork for strong parenting confidence. At its heart, individualized and informed vaccination during pregnancy is about balance. It balances evidence with personal context, prevention with peace of mind. These decisions are meant to support safety, confidence, and emotional well-being for both mother and baby. When care feels thoughtful and respectful, anxiety gives way to trust. With knowledge, guidance, and individualized support, expecting parents can move forward with calm, clarity, and confidence.